Initial, or Monday-Thursday sterile line setup for infusing IV fluids through a UAC, umbilical arterial catheter. UAC IV fluid change supplies, ordered fluid, procedure cart, Sani wipes, sterile drape, surgical cap, mask, 2 pairs of sterile gloves, clean gloves, hand sanitizer, 1 sterile 10 ml normal saline flush, 30 ml IV syringe for TPN infusing less than 2 ml or 50 ml IV syringe, 3 4x4 gauze sponges, 3 alcohol pads, label, lipid tubing, 2 medication tubings, UAC transducer, 1 microclave, disinfectant cap. Place TPN bag and lipid syringe on one side of the procedure cart. Carefully open sterile drape and place on the top of the procedure cart, ensuring that the top side remains sterile. Carefully open sterile supplies and place them individually on the sterile field. Connect TPN transfuse to the transducer. Connect sterile 10 ml syringe to 1 medication tubing and prime medication tubing. Remove sterile flush. Connect sterile 10 ml syringe to the other medication tubing and prime medication tubing. Connect 1 medication tubing to a microclave on the TPN trifuse, and prime the line. Connect other medication tubing to a microclave on the TPN trifuse, and prime the line. Connect lipid tubing to a clave, then to the stopcock after the transducer. Lipids cannot be infused through the transducer. Turn on all ports on the stopcock. Connect IV syringe to TPN dual check valve. With one hand, use a sterile 4x4 gauze to lift lipid syringe and hold syringe. With the other hand, use a sterile 2x2 gauze to remove cap from lipid syringe, discard cap and gauze. Connect lipid syringe to lipid tubing. Prime entire lipid tubing using sterile 4x4 gauze. Place lipid syringe back on non-sterile surface. Clamp lipid tubing. With one hand, use sterile 4x4 gauze to hold TPN bag. Spike TPN bag with dispensing pin on TPN tubing. Draw TPN into IV medication syringe. Remove syringe to purge excess air. Reconnect to TPN dual check valve. Prime transducer with TPN. Remove ink cap from transducer kit. Put in caps in place to maintain sterility of the tubing's internal surface. Some caps may need to be removed or loosened momentarily. Prepare patient UAC access for connection. Vigorously scrub microclave with alcohol swab on patient's IV access for 15 seconds, and allow to dry for 15 seconds. Connect trifuse to patient UAC access. Place disinfectant caps on 1 medication tubing, if needed. Zero transducer when all lines are connected to the patient.